you never know where life is going to take you. You never know what doors are going to open, and you never know what's going to happen when you walk through them. It wasn't part of the plan when I graduated from
Mm.
physiotherapy. No, I was not interested in research at all. And so I had worked. I had worked for a few years in as a physiotherapist. I worked in a hospital. I got a job right away. I started off in complex continuing care, which at
Okay.
one of the hospitals in Toronto. It's so fascinating to me. So I there was no reason for me to leave.
Okay.
Um, and then at that time, the physiotherapy profession in Canada was moving from an undergraduate degree in physiotherapy, which is what I have,
Mm-hmm.
towards a master's, and
Okay.
which I didn't have. And so as schools are moving towards that, I was realizing that the students that I might have been supervising who were coming into placement with me, I was starting to get involved with a little bit of teaching at the university, being a lab tutor
Mm-hmm.
and a case facilitator that, these students were now going to have a degree that was more than mine. And should I
Okay.
consider a master's? So I became reconnected with Dr. Dina Brooks, and she knew me from my undergrad as PT, but she thought maybe Ada would be interested in doing her master's, so asked me about it. And it was probably just that spark that I needed to push me over and say, well, yeah, okay, maybe I would consider research.
Yeah.
Get a master's, try some research, and then go back to being a PT. And then now we all know what happened. I just continued along that path. So